Welcome to The Explainer. Today, we're going to tackle one of the most intimidating parts of nursing school and, let's be honest, clinical practice: lab values. You know, this quote right here from Gina, an RN, it just says it all, doesn't it? It can feel like you're stuck in quicksand, just drowning in numbers. But I promise you, we're going to yank you right out. By the end of this explainer, you'll have a much more solid footing. So picture this. The lab report comes back, and it's just a wall of data. Your mind goes a little blank. Where do you even start? Well, our goal here is to give you the tools to transform that wall of numbers into a clear story about what's really going on with your patient. Okay, let's dive in. The very first step is to completely change how you even think about labs. Seriously, forget about just memorizing numbers. From this moment on, you're an investigator. Every single number on that report is a clue. It's a piece of evidence telling you a story about what's happening inside your patient's body. And your job, as the nurse detective, is to piece all that evidence together. It's how you solve the clinical puzzle and make those critical, sometimes life-saving decisions. Our first big clue in this investigation is the arterial blood gas, or ABG. Now, I know this one can seem super intimidating, but we're gonna break it down. We're gonna make it a simple but really powerful tool for you. So what makes an ABG so powerful? It's all about where the blood comes from. An artery. This gives us this incredible big picture view of the body's pH balance and oxygenation. It's the pure, unfiltered story of what's happening system-wide. So you have these three key values: pH, PaCO2, and bicarb. Think of them as being in this really delicate dance with each other. The body works so hard to keep that pH locked in an incredibly narrow range from 7.35 to 7.45. If it tips even a little bit one way or the other, that's a huge red flag that something is wrong. So how does the body pull off this amazing balancing act? Well, it's all about teamwork. You've got two main players. Think of PaCO2 as the respiratory value. That's all managed by the lungs. And then you have HCO3, the bicarb, which is the metabolic value, managed by the kidneys. They're partners, constantly adjusting and compensating for each other to keep that pH right where it needs to be. Okay, let's move on. We're going to zoom in on two really critical electrolytes where even the tiniest changes can have massive, massive consequences: potassium and sodium. And to really get a handle on these two, you just need to remember one simple little word: piso. Potassium is primarily inside the cell, sodium is primarily outside the cell. That's it. This simple fact governs almost everything from how our nerves fire to how our body manages fluid. Just remember, piso. So you're scanning a lab report and you see this: potassium, 6.2. Now, the normal range is just 3.5 to 5.0. This is a condition called hyperkalemia, and it is, quite literally, an emergency hiding in plain sight. Why? Because of what it does to the most important muscle in the human body: the heart. So how do you spot these danger signs of high potassium? Well, thankfully, there's a really powerful mnemonic for this one too: murder. M is for muscle weakness. U is for urine changes, like very little or no urine. R is for respiratory distress. D is for decreased cardiac contractility. E is for those telltale ECG changes. And the final R is for reflex changes. Knowing this isn't just for a test, it's for recognizing a true life-threatening emergency. Now let's talk sodium. With sodium, the biggest danger isn't just a low number, it's how you fix it. Correcting low sodium too fast can be catastrophic. It can cause a devastating and often permanent neurological condition called central pontine myelinolysis. It literally destroys a part of the brainstem. So with sodium, the rule is always go slow. All right, let's shift gears. We've talked body chemistry, now let's talk about the body's alarm system, the one that sounds when there is an infection. I'm talking about the white blood cell count. So a normal total white blood cell count is somewhere between 4,500 and 10,000. But, a high number just tells you there's a fire. It doesn't tell you what kind of fire. The real detective work happens in the differential. This breaks down which white blood cells are elevated. So for example, if you see a huge spike in neutrophils, that's pointing you very strongly toward a bacterial infection. So you might be on the floor and you hear a doctor or a senior nurse mention a left shift. What on earth are they talking about? Well, it means the lab is seeing a high number of immature neutrophils. They're called bands. When they're over 8%, it's a huge red flag. It means the infection is so bad that the bone marrow is kicking into overdrive, pushing out these baby white blood cells before they're even fully mature. Okay, let's take a deep breath. We've gathered clues on acid-base, we've investigated electrolytes, and we've sounded the alarm on infection. So what now? How do we put this all together and turn these numbers into confident, safe action at the bedside? It really boils down to 3 key things. First, and this is the most important one, you have to connect the numbers to the actual person. Do the labs even match how your patient looks and feels? Second, you've got to know your normal values cold so you can spot something abnormal in a split second. And third, use those mnemonics like PISO and murder. They aren't just little memory tricks. They are clinical superpowers that help you organize your thoughts in a crisis. And I really want to leave you with this. I know mastering lab values can feel overwhelming, but it is an absolutely 100% achievable skill. You can do this, and you're not alone in learning it. At the end of the day, these numbers aren't just data on a screen. They are the voice of your patient, telling you exactly what they need. And your job is to learn how to listen.